Hi everyone, my name is Bianca Palmisano. I'm the owner of Intimate Health Consulting, and thank you so much for joining me for the Sex Advent Calendar. This is 25 days of sex education all through the month of December. Today we're going to be talking about safer sex with penises. And a lot of different people have penises, not just cisgender men. So we're going to be talking about a range of experiences for people including genderqueer individuals, transgender men who have undergone genital surgery or who are taking testosterone, as well as transgender women who may be on estrogen but have not had any kind of genital surgery. Now, regardless of what your identity is, there are a number of tools that we can use to have safer and better sex. And two of the standbys are condoms. So there are two types. External condoms, known as male condoms more colloquially, are things you're probably fairly familiar with, so I won't spend a whole lot of time on that. But the other one that I want to talk about is the internal condom, or the female condom. So condoms are really useful because they provide a physical barrier between a penis and any other kind of mucous membrane, so whether that's a mouth or an anus or a frontal. And that means that they help prevent the transmission of fluid, as well as preventing skin-to-skin contact that can cause the transmission of different kinds of STIs. So a female condom or an internal condom is really great because it can be used for anal sex, which is what I like to bring up in particular. So if you're going to use it for that reason, what you want to do is make sure that you take out the flexible inner ring that is included, and this is used to keep the female condom in place if you're using it inside of a vagina or front hole, but you don't want it in an anus. Then you can insert it ahead of time, and it's going to stay anchored in place for anal sex. And so it's a really nice, easy way to keep your sex safe and fun, and it comes pre-lubricated, so it's smooth going in. Another option for safer sex is the dental dam. So a dental dam is essentially just a thin piece of latex, and it is useful as a barrier between your mouth and any mucous membrane that you are going to touch your mouth to. So again, this is really great for rimming as well as for using on a person that has a front hole. The great thing about dental dams is they are useful not only for preventing STI infection, but also for making sure that the bacteria that inhabit your colon don't come in contact with your mouth. While a lot of them are harmless bacteria, some of them can cause intestinal distress, and so you're going to be much better off keeping a barrier in place between your mouth and the opening of the anus. Gloves are another great option as a barrier, especially if you don't have a dental dam, because these aren't the easiest thing in the world to find. So gloves are great for finger sex because everyone can use their hands during sex, and they're also great if you want to split them down the side to make an impromptu dental dam. Lastly, they're really great for cocks that have been exposed to hormone therapy because those cocks are probably a little bit small for a female condom or an external condom, but they're just the right size for the thumb hole of a glove. So what you need to do to make a dental dam that accommodates a cock that's been exposed to testosterone is just to go ahead and cut the fingers off of the glove like this, and then go ahead and split it down the far side as well, so the side that doesn't have the thumb attached to it. So then you have a nice big strip of latex or nitrile, and you can slip the thumb hole right over that cock and lick, suck, or play with it however you want. A couple other really important tools to talk about in terms of safer sex with penises don't actually have to do with physical barriers at all. Some of you may have heard of PrEP, which is pre-exposure prophylaxis. It's a pill that you take once a day to help prevent the transmission of HIV if you have a partner who's HIV positive and you're HIV negative. If you are not interested in PrEP or you want another tool in your toolbox, I encourage you to look into seropositioning. So seropositioning is essentially a way of orienting our sexual activity to do the things that are the least risky. So we know that receptive anal sex is the thing that's most likely to transmit HIV because tears in the lining of the anal canal is where the virus can go in and enter the bloodstream. So if you have a partner and one of you is HIV positive and one of you is HIV negative, seropositioning would involve having the partner that is HIV positive be the receptive anal sex partner. Or to do activities that have less risk in general, like oral sex, digital sex, sex with fingers, etc. Now, the other thing that you can do to protect yourself, not from HIV, but from other infections, is to make sure that you're up to date on your vaccinations. Most of us, if we were born after 1991, have had the hepatitis A and B vaccinations as part of our regular primary care, but you may want to check with your doctor to see if you've actually gotten this vaccine, and if you haven't, to just go ahead and do it. The other vaccination that you want to think about is HPV, and that's the human papillomavirus. So HPV vaccines are recommended right now for young girls before they've started sexual activity, but they are available to and useful for everyone. So you can get those from your doctor. It's a series of 3 shots, and this is particularly useful if you feel like you may be a passive carrier for the virus and that you're worried about transmitting it to someone else. Lastly, I want to talk about lube, which is so important with any barrier or not that you choose to use. So I recommend 2 different types, either a water-based or a silicone-based lube. Water-based lube is really great because it absorbs into your skin just like water. So your mucous membranes recognize it as something natural and normal to be occurring in that area of your body. Silicone lube is not really natural. Our body doesn't produce or absorb silicone, so it lasts a lot longer. It's thinner and less sticky than water-based lube, but it's not good if you're going to be using any kind of silicone-based sex toys. It'll make a gooey, mucky mess, so you don't want that. But the main thing you want to avoid is to use any kind of oil-based lubes. So no olive oil, no canola oil, no coconut oil. Don't get creative here. Oil-based lubes are not good because they degrade latex. So if you are using a dental dam or a condom, it can cause it to break much more easily. And then that kind of defeats the whole purpose of having safer sex. Also, please don't use any kind of numbing creams like anal ease to make sex less painful. That is your body's natural response to stimulus, and you want to be able to make sure that you're in tune with it. So when you numb out a nerve ending, you aren't going to be able to be aware when something is going wrong. Those natural pain responses are important. They're telling you when to slow down, when to relax, when to maybe take a break. So please, 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 just regular lube, no numbing creams. Now, I'm also going to include a link to my Safer Sex Bingo card, which is a really fun way to start a conversation with your partner about different ways that you can incorporate safer sex into your play. And lastly, I really want to encourage you to take care of yourself, just in general. That means staying up on your mental health, making sure you're adherent to your medications, getting tested regularly with your primary care doctor for STIs, and doing that all-important self-care, whether that's something great like taking a bubble bath and reading a nice book, or whether it's the boring stuff like making sure that you have fresh vegetables in your fridge. I also really encourage you to increase your fluid intake. I think it's something that a lot of us have trouble with, but it's really important for preventing things like prostatitis and urethritis and other nasty urinary tract issues that come from not having enough liquid in our systems. As always, make sure that you go to the doctor if anything is itching or burning or you have any unusual discharge. And I'm going to include a couple other wonderful educational links about ways to put on condoms, how to have great safe sex, and how just to have better conversations about intimacy when you're playing with penises. Thank you so much for joining me, and I hope that you stick around for all the rest of the 25 days of sex ed. Thank you, and have a great one.